Hello, friend. Welcome to Pharma Today. Adhering to the sodium intake levels recommended by the World Health Organization, WHO, could potentially prevent 300,000 deaths attributed to heart disease and chronic kidney disease over the next decade, according to a modeling study conducted by the World Health Organization. Excessive sodium consumption, primarily from salt, is identified as a significant dietary risk factor for mortality and morbidity. In high-income nations, packaged foods represent a major contributor to sodium intake, a trend that is increasingly observed in low- and middle-income countries as well. Researchers, including experts from the George Institute for Global Health in Hyderabad, have pointed out that India lacks a national strategy for sodium reduction, despite the fact that its population consumes twice the recommended sodium levels and is increasingly reliant on packaged foods. The WHO advises a daily sodium intake of less than 2 grams, which is approximately equivalent to less than a teaspoon or 5 grams of salt. Findings published in the Lancet Public Health Journal indicate that significant health improvements and cost savings could be realized within the first decade of compliance, including the prevention of 1.7 million cardiovascular incidents, such as heart attacks and strokes, and 700,000 new cases of chronic kidney disease, alongside an estimated savings of $800 million. The authors emphasize that the modeling results strongly advocate for India to implement the World Health Organization's sodium benchmarks, particularly as the consumption of packaged foods continues to rise. Reducing sodium intake by 30% by 2025 is one of the 9 global targets proposed by the World Health Organization for the prevention and management of non-communicable diseases. Countries such as the UK, Argentina, and South Africa have demonstrated that establishing targets for sodium content in packaged foods, coupled with collaboration with food manufacturers to reformulate products to meet these targets, can effectively decrease sodium levels in packaged foods and subsequently lower overall intake within the population, according to the authors. In India, there are limited initiatives aimed at tackling the problem of excessive sodium consumption, according to the researchers. Initiated in 2018 by the Food Safety and Standards Authority of India under the Ministry of Health and Family Welfare, the national campaign Eat Right India seeks to promote awareness about healthy dietary practices, which includes reducing sodium intake, the researchers noted. Nevertheless, the potential effects of implementing sodium targets for packaged foods on the overall consumption levels among the population remain unclear, they stated.